In the realm of hospitals, where relief should reign supreme, there's a concerning trend emerging. Have you noticed it? It's the unsettling rise in patient deaths due to medical negligence. Rahib Reza walked into the hospital for what should have been a routine procedure, feeling confident in his chances of a positive outcome. Yet, he was shocked to find himself facing a life-threatening situation simply because his doctor overlooked his medical history. Now, put yourself in the shoes of his devastated family member. What actions would you take if your loved one became a victim of such oversight? Would you seek accountability or resign to fate? And for those working in the medical field, how does this strike you? Can you imagine the weight of responsibility knowing life was lost due to oversight? Today, we will be discussing the tragic case of Rahib Reza, who sought medical treatment for fatty liver disease, only to be confronted with a nightmare far beyond his initial diagnosis. Rahib, the beloved son of Rizwal Haque, a dedicated 31-year-old information technology consultant and project manager at StarTech in Dhaka, died on Monday, February 19, 2024, after complications arose during an endoscopy procedure. Rahib, like many others, was seeking treatment for fatty liver disease. He sought medical attention at Labaid Hospital in Dhanmondi under the care of Professor Mamoun Al-Mahtab. Assured of a routine procedure with minimal risks, Rahib underwent the endoscopy as part of his treatment plan. However, the situation took a somber turn when Rahib was presented with the choice of anesthesia or staying awake during the procedure. Unaware of the potential side effects, Rahib opted for anesthesia to be administered. The procedure itself was brief, lasting less than a minute, after which Rahib was sent for observation as per standard protocol. Tragically, just an hour and a half later, Rahib's family noticed a rapid deterioration in his health instead of an improvement, casting a shadow over what was supposed to be a routine and safe medical intervention. Rahib Reza's family contends that Labaid Hospital administered anesthesia to him without reviewing his test reports beforehand. Despite his known physical complications, they assert that an endoscopy was performed, leading to a heart attack and ultimately his demise. However, Professor Mamoun Al-Mahtab, formerly the chair of the hepatology department at Bangabandhu Sheikh Mujib Medical University, BSMMU, who conducted the procedure, claims he was unaware of Rahib's pre-existing conditions. According to the family, Professor Mamoun Al-Mahtab recommended an endoscopy for Rahib on February 15th. Following this advice, Rahib underwent the procedure at the hospital around 11 p.m. the following day. Approximately an hour and a half later, Rahib's condition began to worsen, prompting his transfer to the hospital's ICU. Despite 3 days of treatment, he was pronounced dead on Monday morning. His friend Farham Islam, who was with him at the hospital, said, Reza's prescription recommended no endoscopy with injected anesthesia as he was overweight. However, the medical personnel at the hospital injected anesthesia, he said. Soon his physical condition deteriorated, but nobody cared about him as there was no monitoring of the patient until the patient was shifted to the ICU of the hospital on Friday. The family firmly believes that Rahib's death could have been avoided if the hospital had conducted a thorough consultation and inquired about his previous medical conditions before initiating any treatment, seeing that Rahib had sleep apnea, and as such it would be a high risk if he was given anesthesia. This perceived negligence by the medical staff has tragically resulted in the deaths of numerous patients who sought treatment for minor health issues. Due to lapses in attention from medical personnel, these patients often end up in worse conditions or, as in Rahib's case, succumb to the unintended consequences of receiving medications or procedures that were not suitable for their medical history. After numerous complaints had been laid against the hospital, the doctor in charge of Rahib's procedure came forth and gave his narrative. Professor Mamoun Al-Mahtab recounted Rahib's consultation for fatty liver disease, during which an endoscopy was recommended. According to the doctor, he presented Rahib with two options: undergoing the procedure under sedation or staying awake. Rahib chose sedation. The endoscopy itself, as described by the doctor, was brief, lasting less than a minute, after which Rahib was transferred for observation. After his transfer, the nursing staff informed us of the patient's deteriorating condition upon monitoring. Alongside myself, there were 7 to 8 individuals, including 2 doctors and 3 nurses, overseeing his status. We promptly responded, administering necessary interventions to stabilize him. Although his oxygen saturation and blood pressure initially improved, Rahib remained unconscious. Unfortunately, his condition worsened after that, with a subsequent drop in both blood pressure and oxygen saturation, Professor Mamoun Al-Mahtab explained. It was a harrowing scene at the hospital when nobody from Rahib's family showed up by his bedside. Despite frantic attempts to reach them, there was no one to fill them in on his deteriorating condition. The one glimmer of hope came from Rahib's colleague, who stepped up to the plate, promising to break the news to his family. As Rahib was swiftly wheeled into the ICU and hooked up to vital oxygen support, the tension was palpable amidst the whirlwind of medical activity. Then, out of the blue, Rahib's heart gave out, plunging everyone into a state of emergency. Professor Mahtab, the attending physician, shed light on the intense challenges faced in the ICU, highlighting the absence of crucial readings like oxygen saturation and pulse rates. "That's when we made the tough call to start life support," he recounted, reflecting on the gravity of the decisions made under pressure. He stayed vigilantly by Rahib's side well into the night and returned bright and early the next morning, even before his clinic hours, showcasing his unwavering dedication to his patient's recovery. Prof. Mahtab made it clear that transparency was non-negotiable when dealing with Rahib's family, emphasizing the establishment of a medical board at their behest. Speaking on behalf of the family, Maqbool echoed their heartfelt appreciation for the hospital's relentless efforts, underscoring the invaluable human touch and support during such trying times. On Sunday morning, the patient was pronounced brain dead, and his family was promptly notified of the grave situation. "I explained to them that if they wished, they could opt to keep him on life support," recalled Prof. Mahtab. The patient's mother expressed their desire to pursue treatment on life support, holding on to hope for a miraculous recovery. However, by Monday morning, the patient's organs had begun to fail, he continued solemnly. When questioned about Rahib's medical history, Prof. Mahtab revealed that they later discovered he had sleep apnea. The patient had septicemia, a lung infection that led to blood ingestion, stemming from an infection elsewhere in the body. None of this crucial information was disclosed to us. His blood count was elevated, likely due to the lung infection, but even this detail was not shared, he added with concern. Prof. Mahtab refrained from blaming Rahib for not divulging his sleep apnea. "Perhaps he wasn't aware of the necessity to inform me. Testing for sleep apnea requires an overnight stay in the hospital with monitoring equipment," he explained, highlighting the potential oversight in communication. The doctor acknowledged that while they might have overlooked some crucial questions, gathering complete medical histories from all patients is challenging, especially when some may not fully grasp the risks associated with certain medications and procedures. Additionally, determining conditions like sleep apnea can be elusive without prior knowledge. He emphasized the medical risk of administering anesthesia to a patient with sleep apnea, highlighting that Rahib's choice of anesthesia during his procedure ultimately led to his heart attack and tragic passing. As the medical team wasn't aware beforehand, he made it clear that he holds no blame towards the family for the oversight. After realizing the mistake, the hospital acted swiftly to try and rectify it, hence the provision of oxygen and Rahib's transfer to the ICU. However, despite their efforts, it wasn't enough to undo the damage, and Rahib tragically succumbed to a cardiac arrest following what should have been a routine endoscopy procedure to address his fatty liver. Following the doctor's statement, Labaid was allowed to share their side of the story regarding the patient's encounter. Chowdhury Meher-e-Khuda, the public relations officer of Labaid Group, provided clarification on the series of events. He explained, "The patient arrived for an endoscopy procedure and unfortunately suffered a cardiac arrest while undergoing the procedure. As a result, he was promptly admitted to the ICU for further care. It is regrettable that we only became aware of the severity of the situation after the cardiac arrest had taken place." Despite our best efforts, the patient passed away 72 hours after being admitted to the ICU. Up to this point, we have not received any formal complaints against our facility. The laboratory, responsible for conducting the procedure, simply adhered to the instructions provided to them for performing the endoscopy with anesthesia. They were not informed of any pre-existing conditions the patient may have had before the procedure. While Rahib Reza's case may not solely stem from negligence or incompetence on the part of the doctor, instances of medical negligence and incompetence are undeniably increasing in Bangladesh. This alarming trend has resulted in the unnecessary loss of hundreds of lives, highlighting a pressing medical crisis. The public is rightly urging the medical board to closely examine all medical professionals as they hold the lives of thousands in their hands. Doctors must ensure thorough coverage of all medical aspects and ask pertinent questions before initiating treatment. In cases where a patient is unable to communicate, the establishment of a comprehensive database containing patients' details from all hospitals could prove invaluable. Such a system would ensure easy access to patient information, thereby reducing the likelihood of miscommunication between patients and doctors in the future. The family of Rahib Reza has made the difficult decision to pursue legal action against the hospital. They firmly believe that their son's tragic passing could have been prevented if the medical staff had been more attentive and thorough in their approach to his care. They expressed deep concern over the treatment Rahib received, sharing that he was neglected and lacked proper aftercare until his condition deteriorated, prompting his urgent transfer to the ICU. Sadly, by then it was too late to save him. Amid the troubling surge of negligence cases in hospitals across Bangladesh, patients must take proactive steps. Always remember to provide a comprehensive medical history and disclose any existing conditions or medications to your doctor. Now let's talk action. What measures will you personally implement during your next doctor's visit to ensure they're fully informed before proceeding with any procedures? Stay tuned for further updates on the case of 31-year-old Rahib Reza. If you found today's video informative, don't forget to like, share, and leave a comment, as we love to hear from you, our viewer.